The numbers of infections rise and hospitals are in full capacity. There is pressure on health workers functioning in different capacities, from their personal protection to their mental state. So it really wouldn't be out of place for these medical workers to also undergo some form of psychological counseling before and after work, as they are on a daily basis faced with hard decisions with what they experience in the hospitals. They also need to be adequately protected from the virus as they carry out their duties. Recently, the WHO says over 10,000 health workers in Africa are infected with COVID-19.
Some countries are approaching a critical number of infections that can place stress on health systems. South Africa is now among the worst hit countries in the world.
We have had 10,000 healthcare workers. We're aware of 10,000 healthcare workers having been infected in the region. From the information that we are getting daily from our country teams, through, having come from the ministries of health, that the majority of those who have been infected have been nurses, but we have had all categories of healthcare workers, doctors, laboratory technicians, and even some of the people who are providing ancillary support in healthcare settings infected.
Good evening, Onimis. Thank you for having me.
It's a pleasure having you in. So straight to the matter, inadequate access to personal protective equipment or weak infection prevention and control measures raise the health or the risk of health workers' infection. Tell us about this as it pertains to Africa.
Okay, so as we just had in the clip with the WHO Afro Regional Director, health workers in Africa have been affected by the COVID-19 infection, and unfortunately, Nigeria is not spared. According to the NCDC, June 2020, over 800 healthcare workers have been infected with COVID-19 in the course of discharging their duties. Again, this ranges from doctors to various cadres of healthcare workers. We've had incidences of laboratories in Kano and even recently in Ebonyi State being shut because laboratories had to be decontaminated due to infection that happened among the healthcare workers happening in that laboratory. So as healthcare workers give their best to mount a good response to COVID, they are also being infected in the process of the response.
Okay, so in many